Welcome back. Health Canada has approved a label change for vials of the Pfizer vaccine. Labels will now indicate that each vial contains 6 doses instead of the original 5 doses. The change comes despite concerns from some provinces that a 6th dose can't always be reliably extracted. Here's Alberta's Health Minister Tyler Shandro on the decision earlier today.
It is frustrating. I think we made it clear to the federal government and to Health Canada that everybody gets the best training, everybody is using the right syringe. We're only going to get that 6th dose 75% of the time max. So it means that the provinces are, in the end, because the federal government has contracted out on the basis of doses, not vials. So it means that the provinces are going to end up not getting as many doses, I think.
Let's get some more reaction from Dorothy Shepherd. She's New Brunswick's health minister and with us from Fredericton. Hi, Minister. Good to see you. Thanks so much for making the time.
Thank you. Nice to be here.
Do you have any concerns around being able to reliably extract that 6th dose?
Absolutely. Even right now, we're getting extremely low percentages of a 6th dose. And so we know that with the low dose syringes, that's going to be even more difficult. Those syringes have been ordered and some are on the way, but it will be very contingent on receiving those low dose syringes to get the 6th dose the majority of the time.
Are you confident that if you are to receive an adequate number of those different syringes that you will be able to extract it all the time?
No, I'm not confident, but the federal government has had almost a year in place. And quite frankly, right now, it feels like they're trying to get the last drop of ketchup out of the ketchup bottle. And we are going to have to do more with less. I think that's obvious.
To be fair, the UK and the US have both approved the same label change. I was reading a tweet from a public health officer in the Niagara region who said that they're able to get even a 7th dose half the time. Is it possible with the right training that your province and other provinces will be able to extract that?
I would never say it's impossible. So we're going to have to be dependent on the federal government and helping us, provide that extra training and get us the proper syringes that we need. And, we were proactive about that 2 weeks ago. We didn't wait for the federal government to place those orders. And so we have, and we'll be receiving some next week. And the proof will be in the pudding as to what will bear.
Do you have, or has the federal government rather communicated to you whether or not, if, for example, it turns out you have the right equipment, you have the right training, and you can't get all 6 doses, that Pfizer will guarantee the adequate amount of doses? Like they're contractually obligated, my understanding is, for 4 million doses by the end of March. Has the federal government told you, if you can't get it every which dose, let us know, and we'll make sure that you get enough vials?
Those communications are going on all the time. And quite frankly, there has been so many changes from one week, one day to the next. That we'll just have to monitor it and put in our concerns as they arrive. We won't be shy to do that.
And just on the subject of the overall timeline, because I think so many Canadians, and I'm sure many in your province, are thinking, what does this mean overall? There's some slowdowns now. The federal government is promising that things will ramp up. I know that the premier of your province gave an interview recently where he said it might not be possible to vaccinate everyone in New Brunswick until the end of 2021. Is that where your thinking is, or do you think it still is possible, as the federal government is promising, for everyone who wants a vaccine to get one by the end of September?
Well, I think the assurances are a little bit faded right now because we're dealing with so many contradictions, as I said, 1 week or 1 day to the next. And so, look, I have people calling us every single day wanting to get this vaccine. We know that we're going to try to get those priority groups done, but right now, I don't think there's any guarantee we're going to meet our objectives at any specific time. This is by guess and by God right now. And we're going to do what all New Brunswickers do in times like this. We're going to do our very best and do as much as we can and better.
So you don't think, based on the current information on supply, that is a guarantee for the end of September? Might that change if the supply becomes more certain?
Absolutely. And I mean, we've certainly got our targets in place and we've got our plans in place, but it's all dependent on supply through the federal government, and it's in their hands. We are at their mercy to get what we need.
Okay, and Minister, before I let you go, the Prime Minister also spoke about rapid tests, saying that the federal government had procured 19 million of them so far. How many has your province used?
We've used very little of our rapid testing kits because, on the whole, we've had accessibility to the to the gold standard test that we've been utilizing, and we've been able to keep up with that. We are, however, implementing plans right now to use rapid testing in our border communities, and looking at how we can utilize them for more demographics that tend to be maybe traveling more. So we're providing a plan for that. And quite frankly, I'm really glad we kind of held on to them, because it's obvious that we can't depend on the federal government for that supply and consistently. So we're going to go forward with them in that regard.
Sorry, you can't. I misheard you there. You can't depend on the federal government for supply of the tests, or for something else?
Well, we're challenged with knowing that they're accurate in vaccines, and so if we needed more tests, we can't be confident that we're going to get them either. So we've kept our tests to be used at the most available time and the biggest benefit to our province, and I'm glad we did.
I would challenge you just for a second on that, because there were so many complaints at the outset of the discussion around whether or not the federal government was procuring those tests enough. They did end up procuring them, and now the Prime Minister says there's some concern over some of them expiring. Could you holding on to those tests, for example, lead to some expiring that could have been utilized earlier?
No, our teams have been on top of that, and so we've been very strategic in how we've done our testing, and quite frankly, it has been a good thing for New Brunswick to have been able to use the gold standard test in most of the days. We have used rapid testing in the ERs and in some of the community places where it was most appropriate. So they haven't just been sitting around, but we have been using them strategically.
Okay, Minister, I'm out of time. I'll leave it there. Thank you very much for your time. Really appreciate it.
Thank you. Me too.
New Brunswick's Health Minister, Dorothy Shepherd. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.